So this part I haven't given a lecture on it, but we're still going to discuss in this practical class. So this is another postmortem finding from patient who died of status asthmaticus. This is an old term. Okay, this is old term that we use when patient who had a acute asthmatic attack. Okay, despite all treatment that we give her, give the patient, the asthma did not resolve. Okay, and at the end, she died of asthma. So it's called status asthmaticus, or the new term is now acute severe asthma. And you can see here, compared to the one that we saw earlier of the lung bullae, there's a bit of space, but in this case, there's only a little space between the lung parenchyma and the rib cage. So this indicates there is expansion of the lung, and the lungs here looks appear a bit pale. So this is a cross section of the whole lung, and it shows that there's a little bit flat here because of hyperinflation. Okay, and this paler area, probably there is some exudate inside the lung parenchyma, and this is a mucus plug that has been pulled out from the lush airways. Okay, from patient who died of status asthmaticus. So again, asthma is a condition that is diagnosed clinically, and we rarely, as pathologists, we rarely receive biopsy from asthma patient. Okay, and if we do receive, probably this is either biopsy of a living patient or from a patient who died. Okay, so there's a mucus here on the left side. There's mucus, and this is the cartilage. So it shows that this is this biopsy is taken, this tissue is taken from the large airways. And a lot of cells here, those dark cells are the inflammatory cells. And amongst them, there are big reddish cells. Those are the eosinophils. And the one in the blood, in this blood vessel here, those are the red blood cells. So here it looks a bit busy, and there's loss of, in fact, I could not recognize the epithelial lining of the trachea or the bronchi here. The muscle here looks a bit hypertrophic, and do not observe any glands here. Okay, and the higher power, these are the cells with the pinkish or eosinophilic cytoplasm. Okay, here these are the eosinophils. So if you remember your hypersensitive, your hypersensitive type 1 reaction. Okay, this type 1 hypersensitivity. So this is the main cells that will appear in the acute process.